Colorectal cancer is the second leading cause of cancer death in the Western world. And now more studies are showing that diet plays a critical role in your risk. So here to talk about that this morning is ABC15 Health Insider Dr. Shad Marvasti. Good morning.
Good morning.
So let's talk a little bit about colorectal cancer to begin with. And we're also seeing the incidence of people getting it on the rise.
Some of the things that we saw early on were associations with excess red meat consumption, lack of fiber in the diet. Over time, that actually grew to actually finding carcinogens in our diet. So the World Health Organization a few years back actually cited red meat and processed meats to be carcinogenic, specifically for causing colorectal cancer. And when you look at colorectal cancer, I think upwards of 70% of the risk is really the diet. So that's really the key piece that, we have to look at.
And so the connection here being, of course, we're talking about the colon. And so it makes sense that your gut and gut health would be directly connected.
Absolutely. I think in this study they were looking at, and we're learning more about the microbiome, which is all the good bacteria we have in our body, and how it really is, key to a lot of health conditions. And part of what it does, it also helps with that immune surveillance, where you're going to find, precancer cells, and in the case of colorectal, that's the polyps that kind of can grow into colon cancer. And so basically, the healthier our microbiome, the less likely we're going to get these types of cancers and other diseases like diabetes, heart disease, obesity. And that makes sense now that we're actually starting to see these mechanisms, because one of the things we've known for decades is that people who don't get enough fiber in their diet have a much higher risk of colon cancer. And the real source of fiber is plant-based, real plant-based food, like whole fruits, whole vegetables, not juices. And the main food, it turns out, for the microbiome is actually fiber. And so when you look at how much fiber we're getting, 100 years ago, we would get an average of 40 or 50 grams or more of fiber every day. Now we're getting closer to like 7 to 8 or 9 grams of fiber every day. So that's decimated the diversity of our microbiome. So we're starting to make those connections. And the standard American diet, which is sad, as I've said, also includes over 70% processed foods. And specifically for colorectal cancer, it makes sense because these foods are low or no fiber. They're high in excess sugars, excess sodium, and there can also be a number of different animal products mixed in there as well. So all these things that are bad for our gut, which help to increase the risk of this. So I think that may be a real reason, because of how deteriorated the state of our diet is, for why you're seeing this kind of increase in recent years.
The recommendation has always been screening for colon cancer, and that is still recommended. You should still be doing that once you are of a certain age, but now it certainly does seem like, aside from screening, your other big prevention factor is your diet.
They've brought the screening age down because there's more people, younger people, getting diagnosed. It used to be that the first colorectal cancer screening, the colonoscopy, is at age 50. We brought that down to 45. You don't need to wait for that colonoscopy. You can start preventing it by adding more plant foods, more fiber, reducing meat and processed meat in your diet. So we can do that right now and make a huge impact, and you don't have to wait for the colonoscopy, so that when you get the colonoscopy, you're going to be free and clear.
And it all starts right in your own kitchen. It's just that easy to start. Dr. Shad, as always, we appreciate your guidance and insight.
Thank you.